As discussed in the previous slide, the body has to metabolically adapt when there is not enough energy available. These adaptations include decreased levels of the hormone IGF-1 and estrogen. A decreased level of IGF-1 directly decreases the amount of bone formation. Decreased level of estrogen directly alters bone resorption. These two hormone deficiencies work independently and in combination to impair bone health. But the combination of the two deficiencies working together is more severe than either deficiency alone. When a woman is both energy and estrogen deficient, her levels of bone resorption are much higher and her levels of bone formation are much lower. In other words, osteoclast activity increases and osteoblast activity decreases. In an amenorrheic athlete, trabecular bone changes include decreased density and number, but an increase in spacing. Changes in cortical bone include overall thinning. All of these components lead to an overall lowered bone mass density, or BMD.